Hello, class. Good morning, everyone. Can you hear my voice? If you can hear my voice, please type yes in the chat box. Good morning. How are you? You can type and tell me how you are in the chat box. Are you good? Type good morning, teacher. I'm good. I'm fine. Okay. Morning greetings. Hello, Joe. Good morning. How are you today? How are you today, Joe? Are you good? Okay, so I start the lesson. Okay. Today, like we have session 4, unit 4. Okay, so can you turn your book to unit 4, accidents and emergencies? Okay. So first one, I have a situation. Okay. So Minjo, can you unmute yourself and help me read this situation? Here, the verb part. Can you unmute yourself and read this one? Okay, the situation for
Thầy
you.
con không có thấy cái màn hình của thầy ấy thầy.
You see it now? Do you have the book? You don't have the book? Please, okay, like you can come to like campus B, okay, to buy a book. You know that? Okay. The photo.
Dạ bây giờ là mô tả cái hình đó hả thầy?
No, you just read the introduction for me. Read the situation.
Dạ.
Are in a light aircraft. Yes.
Dạ. You are in a light aircraft when it crashes into the jungle. Your radio is broken, so you can't call for help. There are two of you, and you must get ready to walk 100 kilometers to safety. You already have clothes, food, and water.
Okay.
You can take only
10 more things.
Discuss what to take with your partner and explain your reasons.
Thank you. You can take only 10 more things with you, okay? 5 from each list. And now, can you discuss what you will take with you, okay? And explain your reason. Here, we have like some new words, medical, okay, equipment, and general things, right? Okay, so now I'm going to show you the pictures of these objects, okay? We have bandages, we have scalpel. Okay, when I show you the picture, can you have a guess? You match the word to the right picture, okay? So we have bandages, scalpel, snake bite kit, morphine, aspirin, disposable gloves, thermometer, tweezers, a first aid manual, hypodermic needles, adhesive tape. General things we have a torch, a box of matches, soap, mirror, compass, knife, scissors, fish hooks, large plastic bags, cooking pots, a mosquito net. Okay. Please wait for me. I'm going to show you why the picture. Okay, so doubts, I will give you 1 minute. Can you use a dictionary? You can use like an online dictionary, okay, to check the meanings of these words first before I show you the picture and you match the word, okay? Okay, so now I stop sharing the screen with you. I will share with you like the pictures of all the new words here, the objects, and you guess. Unit 4, accidents and emergencies. Okay. Okay, so imagine if you had a plane crash. How could you survive that plane crash? Okay. I have like these objects, these things. Can you take a look at page 22 in your book? You match the word to the right picture for me, okay? You guess these objects. I have put the numbers here, okay? You have a guess and you match the word to the right picture. So now it's okay. You can type your answers in the chat box. For example, you think number 1. If you think number 1 is bandages, you type number 1, bandages. That's it. Okay, you match the picture with the right word, right? We have medical things and we have general things, okay? I give you 5 minutes, okay? You match like the number here to the right word, okay? Medical things and general things, and then you can type your answers in the chat box. Okay, number 1, very simple one. What's number 2? Okay, you type the word and you remember its spelling. Okay, I give you 5 minutes.
Thầy ơi, thầy phóng bự cái hình lên người thầy tại nó hơi nhỏ.
Oh,
Thầy
really? Okay, so you can't see it? Why not? Okay, because I can't like make it bigger. So where do you study? Do you study on your phone? Please use your laptop to study, okay? So that you can see these pictures. If you study on your phone, I'm not sure if you can see these pictures or not. Use your laptop. Okay, so number one is bandages, right? Okay, so if you have some cuts, right, or if you have your fingers cut, arm cuts, right? Okay, so you need this one. You need like a bandage to cover the cuts, right? Number two, what do you think number two is? Can you type your answer in the chat box, please? For number two, okay. I will ask a student for number two. Okay. Can I ask a student for number two? Please wait. Let's see. I need to take a look at like your student list. Okay. Can you type your answer for number two here, please? I need to take a look at your answer. Number two is a scalpel. Very good, thank you. Scalpel. Okay, so a surgeon needs a scalpel to operate, okay, right, or to perform operations or to operate, right? A scalpel. Okay, now number two, and now number three. See, like picture number three here. Very good, you can. Number three is a snake bite kit, right? Okay, so when you go camping, you have to take the snake kits with you because in the forest, okay, like there are a lot of snakes and you may got snake bites, so you must take this kit with you just in case you have a snake bite, and you can use this kit, right? So we move on. Now number five, what you see the word already. Number five is a type of medicine, and we have aspirin, right? Number six, can you guess the word for number six? I think like I taught you this word already, okay? Number six. Number four, aspirin. And number four is morphine, right? And number five is aspirin, okay? Actually, the right answer for number four is morphine. Number five, aspirin. Number six, we have disposable gloves. Good. Okay. So if you use that and you throw it away, you use it only once, we can use the word disposable. Disposable gloves. Okay. Gloves. Okay. For use once only. Right. Disposable. Next one, number seven. Thermometer, very good. If you want to measure your patient's body temperature, right? Okay, you want to check your patient's body temperature, you need a thermometer. Okay, Út Nhi, number 7 is not tweezers. Number 7 is thermometers. Okay, to measure someone's body's temperature. Number 8, tweezers. Very good. Number 8 is tweezers. I agree. Now number 9. Oh, number 9, you see the word already. First aid manual, right? Okay, so this booklet will give you some information about how to give first aids. Okay, how to deal with or like what to do in a difficult situation, in a dangerous situation, right? So this booklet will give you some good advice, some instructions on how to give first aids, right? So we have first aid manual, right? A book manual is a book which gives you information or instruction on how to do something. Okay, so here we have a new word, manual, right? It's a book which gives you information or instructions on how to do something. Okay, number 10. Let me show you this one again. Here, number 10, okay? So the right answer for number 10 is hypodermic needles, right? Okay, hypodermic needles, right? Okay, so you use these needles, okay, like to give injections to somebody, okay, or to give medication to your patients, okay, through the vein, for example, right? Okay, so we have hypodermic or hypodermic needles, right? Hypo means under. Okay, you still remember like the prefix hypo. Hypo means under or decrease. Okay, so hypodermic. Right, okay, so we have hypodermic needles. Okay, now 11. 11 we have number 11 we have adhesive tape. Okay, adhesive tape. That's right. Okay, so you use this tape to stick something, right? Okay, like to stick things together. Okay, adhesive tape. Thank you for that. Number 12. Number 12. Okay, so if it gets dark, okay, and you can't see the way to go, okay, you have to turn on this one. You turn on a flashlight or a torch, okay, to light up the way. So number 12, we have flashlight. Flashlight is American English, okay? And torch is British English, okay? They have the same meaning, okay? But the Americans, okay, like they call it flashlights, but the Britons, they call it torch, right? Next one, number 13. Good. Number 13 is a box of matches. Okay, so when you go camping, if you want to make like a campfire, for example, or you want to have fire to cook something, you have to take with you a box of matches. Okay, if you need fire. Number 14. Soap. Very good. Soap. Number 15. I don't think number 15 is a compass. A compass is number 16. Number 15 is a mirror. Mirror here. Let's take a look again. Okay, number 15 is a mirror and number 16 is a compass. Okay, you might get lost when you are like camping in a forest, so it's necessary to have a compass, right? So that you know which direction to go. Compass. Number 17, we have a knife, right? A knife. Number 18, we have scissors. Number 19, we have fish hooks. Okay, if you want to go fishing, you better take a fish hook with you. Number 20, we have large plastic bags. Plastic bags. Number 21, we have a cooking pot. A cooking pot. And number 22, we have a mosquito net, right? A mosquito net. That's it. Okay, so now in the chat box, can you tell me like what are the 5 things you will take with you? Okay, if you go camping in the forest and you got lost. Okay, for example, like you are left alone. Okay, like on an island. Okay, so what are the 5 necessary things that you want to take with you? Okay, so that you can survive that incident. Okay, and you just type in the chat box like I will take, okay, and then the 5 things that you will take with you to survive, okay, a plane crash accident. And if you can, please tell me why you choose those 5 things. Okay, tell me why you choose to take those 5 things with you. For example, okay, like for me, I think, okay, the first thing I'll take with me is the bandages, okay, because you know, like when I walk in a forest or okay, like I might have some cuts, okay, I might get my knees, my hands, my arm cut, so I need some bandages, so I'll take bandages with me, right? Number 1. I also need, okay, like aspirin. So I take number 5 with me because like in case like I have some aches or pains or Okay, I need some medicine. Alright, so I take aspirin with me. And I'll take number 9 with me too. First aid manual, okay, because like so many bad things can happen when you go camping, when you are left alone in the forest. So you need some instructions on how to deal with like difficult situations, how to deal with specific cases. So you need this book. So I'll bring this book with me. Okay. Now, tell me what you take with you and explain your choices in the chat box, okay? Okay, I'll give you 5 minutes for this activity, okay? You tell me the 5 things that you decide to take with you to survive a plane crash and tell me why, okay? Give your reasons for those choices. I give you 5 minutes, okay? Everyone needs to type your answer in the chat box. Thank you. Okay, so take a look at Mincho's answer. So she will take a box of matches because it is very compact and propitious for many circumstances. It can make you can make fire promptly to keep the temperature or lay off animal and accessory for cooking. Thank you. Good choice. Good explanation too. I'm still waiting for other students' answers, okay, to be posted in the chat box. Kim Ngân said that she would take bandages because if she gets hurt, she uses it to bandage, like her cuts, for example, right? Also, I will bring a compass because it will help me determine the direction. Take a torch to eliminate the roads in the forest. There are many toxic insects, so it is necessary to bring mosquito net. Good choices. Very good, Kim Ngân. Excellent choices. And good explanations too. Okay, so now we continue with the next part of the lesson. Okay. Okay, vocabulary parts, first aids. Okay, so in this lesson you learned some vocabulary about giving first aids, right? Okay. Now, work in pairs. Discuss the questions. I have maybe 3 or 4 questions here. Have you ever experienced a patient with blisters? Right, okay. Have you ever experienced a patient with third-degree burns and patients with severe bleeding? And how should you treat them? Right, okay. So first one, we have the word blister. Blister. Okay, so if you walk a lot, okay, you might have like a blister on your boots, right? Okay. If you don't wear the right shoes and you walk a lot, you might have blisters on your feet, right? Okay. And then we have like third-degree burns. Third-degree burns. Third-degree burn. Okay. Next one we have severe bleeding. Severe is very serious. Severe bleeding. So that patient like bleeds a lot. Okay. Severe bleeding. Severe bleeding. Okay, so now can you type your solutions in the chat box? So for example, you type blisters and then like this. What do you do? What to do? What you will do? Okay, you type your solution. Okay, for blisters, for third-degree burn, and for severe bleeding. Okay, I give you 5 minutes. How can you cope with blister? Third-degree burn and severe bleeding. Okay, I give you 5 minutes and you suggest some solutions, okay, for these problems. Oh, thank you for your solution, Joe. Okay, first, we need to take off or remove. Wow, Kim Ngân gave a very long answer. Okay, first, we need to take off or remove the patient's clothes at burns areas. Thank you. Oh, Kim Ngân, like you copied the text from the internet, right? And you just post it in the chat box, right? Okay. Please, you can refer to some information on the internet, but you have to rewrite with your words, okay? Do not copy and paste, okay? It's very long. Oh, so công hiệu, okay, uses the needle, okay, to puncture the blister. Good. Blisters, I will wash under cold water. Oh, thank you, Bích Duyên. So, how about the third degree burn and severe bleeding? Can you cope with that? Severe bleeding if someone bleeds a lot, right? Okay, how about severe bleeding? Do you have any solutions, any good solutions for severe bleeding? Okay, so June Kim Hong suggests that suggest a solution for third degree burns. First thing I would do is carefully take or cut the clothes of the patient so the damaged skin doesn't get worse. Good choice. And what do you do next? I'm still waiting for your solutions for the severe bleeding, right? Oh, wash your hands before and after giving first aid when bleeding. Locate the bleeding sites for proper treatments. Ask the casualty or paramedic to press firmly, okay, on the edges of the wound with your fingers for at least 5 to 10 minutes to stop the bleeding. Okay, that's right. Okay, and if like you have like some cloth, you can use the cloth to tighten, okay, the bleeding area. I think so. Thank you for all of your solutions. Okay, so let's learn some new vocabulary about first aid. Number 2, can you complete each sentence with a word from the box? So we have these verbs, right? Okay, I'll give you the meanings of these verbs, okay, like in the box. First one, we have apply. This verb is used for cream, okay? So when you apply cream like to an affected area in your skin, on your skin, okay, let's say like apply cream to an affected area on your skin. Okay, applying cream to an affected area on your skin. So use this verb with, okay, a cream, right? Next verb we have check for easy. Immerse. Okay, next verb we have immerse. Okay, so like if you immerse something, you sink something deep in the water, right? Okay. Put something in water. Okay, immerse. Put something in water. Next, we have the verb immobilize. Immobilize. Okay, so if you immobilize a patient, you don't move that patient, right? Do not move that patient, especially for patients with severe bleeding. Okay, we don't move, okay, patients much. Okay, we immobilize patients, right? Okay. Immobilize. Keep easy, but make sure is a puncture. The next word we have is puncture. Okay, so for example, like if someone, okay, like has a blister, okay, you will use, okay, like a clean and a sterile needle to puncture, okay, the blister, right? Okay. And use a sterile needle to puncture a blister. Okay, make sure that, okay, like that needle is clean, okay, and sterilized. Okay, sterile needle to puncture a blister. Okay, remove is easy one. We have squeeze. Sterilize. 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 Okay. Swap. And treats. The word treats is very common. I know, you know this word, treats. Right, okay, so now can you complete the sentences with the right verb for me, okay? Let's get back to the book. Number 2 here. I'll give you 5 minutes, okay? And then I'll call someone to give me your answers, okay? Number 1, we have a clean, sharp needle with alcohol, okay? So, for example, I choose sterilize, so I put sterilize, okay? In the first gap to complete the first sentence, sterilize a clean, sharp needle with alcohol, right? Okay. Okay, so can I ask someone? Give me your answer. So number one, the right answer is sterilize a clean sharp needle with alcohol, right? Okay. So number two, these ways, I'm going to share this PowerPoint slide with you. Okay, so number one, let's take a look at your answers. You have given your answer in the chat box. Okay, number one, we have these words with you. So number one, we have like sterilize a clean sharp needle with alcohol, right? Number two, I asked a student, can you unmute yourself and read the sentence for me, okay? Châu Thị Mộng Kiều, are you there? Can you unmute yourself and read your answer for number two for me? Mộng Kiều.
Yes.
Okay, number two.
Um, Massachusetts last our orders. My body is in the course.
Yes, thank you. In the wound. Okay, thank you. Make sure there is no class or other foreign body, okay, in the wound, right? Okay. So we have like a new word, foreign body. Okay, so the right answer for number two. Now number three. Use the needle two. Easy one, okay. Can I invite Đỗ Thanh Bình? Are you there? So what's your answer for number three here? Can you read out loud your answer for number three?
Thầy có nghe em nói không thầy?
Yes, I can hear your voice now.
Thầy là you the need to burns to
Okay. Use the needle. Repeat. Use the needle again.
use the needle
To puncture. Puncture. The blister.
blister.
Yes, thank you. Use the needle to puncture the blister. Okay. Number 4. Number 4. Đặng Nguyễn Ngọc Đức. What's your answer for number 4? Ngọc Đức is not there. Chu Lan Anh. Number 4.
Don't remove burns clothing.
Oh, very good. Don't remove burns clothing. Okay, so someone, okay, like some of you like has told me, okay, like to remove, okay, like the clothing, okay, of the burns area so that like that burns didn't get worse, but it's not the right advice, it's not the right solution. Okay, so you are advised, okay, like to not remove burns clothing, right? Okay, if you remove the burns clothing, you just make, okay, like the burn worse, you just make it worse. So don't remove burnt clothing, remember. And number 5. Okay, so you got it. Like, I don't know. Okay, so this is in the book. Okay, so you should trust the book. Okay. You should trust the book. That's why, okay, like when you read the information, okay, on the internet, you have to be very careful, okay? Don't remove burns clothing because they believe that if you remove burns clothing, you just make it worse, okay? Okay, so number 5. Number 5, Hoàng Thái Du, are you there? Give me your answer for number 5. A main artery if necessary. Very good info. Squeeze. So the right answer for number 5 is squeeze. A main artery if necessary. Okay, for severe blooding. Sometimes, okay, like we need to tighten on, okay, the area, or we need to squeeze. Just like use our hand to squeeze. Like a main artery if necessary. Okay. To stop the bleeding, right? To stop the bleeding. Next one, number 6. The injured person lying down. So we have like keep, right? Keep the injured person lying down. So let's see. Very good, Cam. Thank you, Cam. The right answer number 6 is keep, right? Keep the injured person lying down. Number 7. The injured body part once the bleeding has stopped. Immobilize. Yes, that's right. Okay, so you don't move the patients, right? Because if you move the patients, okay, like he or she might get bleeding again. Who knows, right? So immobilize the injured body parts. Okay, once the bleeding has stopped. Okay, so like you can move the patients here, but you just immobilize, okay, the injured body part. For example, you do not move like his or her hands, okay, or his or her legs, right? And you just like carry that patient carefully, okay, to the ambulance or to a hospital, right? Number 8, type your answer for number 8. The person for shock. Treats, right? Treats the person for shock. Okay, so your patient might get a shock, so you have to treat the shock. That's right. And number 9, don't severe large burns in cold water. Don't immerse. Okay, so like like the old people from the previous generations, they have like a wrong belief, right? They always like tell us, okay, like to wash burn water underwater, right? To to wash like a burn underwater, but it's not the right solution, right? Okay, so do not, okay, like immerse severe large burns in cold water, because in that way you just make the burn worse. Okay. And number 10, signs of circulation. Number 10, we have check for signs of circulation. Okay. You have to make sure that, okay, blood, okay, flows, like normally in other parts of that patient, okay, in other body parts. Have to make sure that blood flows, like normally and easily in other body parts. Check for signs of circulation. And number 11, with iodine or rubbing alcohol. We have swab with iodine or rubbing alcohol, right? And number 12, apply antibiotic ointments and cover with a bandage, okay? Thank you for giving me your answer. Okay, so now we have like 12 steps here, 12 solutions. Now you have to put these solutions to the right situation, okay? So how will you treat these conditions? A, blisters, okay? B, third-degree burns, and C, bleeding, severe bleeding. Can you type, for example, like number 1, step 1? Solution 1, sterilize a clean sharp needle with alcohol. So if you think that is the right solution for dealing with blisters, you type, okay, blisters 1, and then like 3 more solutions, okay? So each condition requires 4 solutions, okay? Each condition here requires 4 solutions. So can you match the right solution to these solution. I'm sorry, these conditions. Okay, Chung chose, okay, like chose what solution 3, 11, 12, and 1 for treating blisters, right? Yes, good choice. Thank you, Joe. That's the right choice. So solution 1, solution 3, use a needle to puncture the blister. Solution 11, swab with iodine or rubbing alcohol. And solution 12, apply antibiotic ointment and cover with a bandage. Perfect. Condition number 2, third degree burns. I need 4 solutions for condition number 2. Công Hiểu chose 4, 8, 9, 10. Okay, that's right. So we take a look at, okay, line solution 4, don't remove burns clothing. Agree. Next one, number 8, treat the person for shock. Agree. 10 and 9 first, don't immerse severe large burns in cold water. And number 10, check for signs of circulation. That's right. And bleeding, severe bleeding. What are the last 4 solutions for, okay, like severe bleeding? Okay, so the remaining solutions are for severe bleeding, right? 2, 5, 6, 7. Number 2, make sure there is no class or other foreign, okay, body in the wound, right? Okay. And number 5, squeeze a main artery if necessary, okay? Here, right? So squeeze the main artery if necessary. Squeeze a main artery if necessary. And we have number 6, keep the injured body, okay, lying down. Keep the injured person lying down. And number 7, immobilize the injured body part once the bleeding has stopped. Can you check your answers, please? Okay. Okay, so we continue with the language spots. Okay, so today we will learn how to give instructions and advice by using, okay, like to give comments, okay, to give advice. So we can use like verbs Okay. The bare infinitive forms of the verb to give advice, okay, or to give, okay, like okay, so actually like we can use like imperative form of the verb. Okay, the right name is imperative form of the verb to give advice or to give comments, right? Okay, so take a look at this slide. To tell somebody what to do, you can use the imperative, like check for signs of circulation, apply the pads to his chest. So the structure is very easy. Okay, to give comments or advice or instructions, just use the verb as object without subject. Without subject. Okay, so instead of saying you have to check for signs of circulation, so you have to is omitted, and it just starts with a verb, right? Okay, check for signs of circulation. See, okay, so an imperative starts with a verb, right? Okay, imperative starts with a verb. To tell somebody what not to do, you use don'ts. Okay, use don'ts, not doesn't. For example, don't remove burnt clothing. Easy. So the negative form of imperative is don't plus verb. That's it. Don't plus verb. To emphasize what is important, you can use make sure the wound is clean. Alright, so we have make sure that, you can use that or without that, plus subject plus verb, right? Okay, make sure or make sure that, and then we use a clause, subject and verb after that structure. Make sure you don't touch his body. Okay, when asking for instructions, you can use present simple, have to, shall, and should. What do I do now? Easy one. Do I have to immobilize his leg? Shall I? So instead of using do I, the present simple, you can use shall I. Shall I take off the dressing now, right? What dosage should I give him, right? Okay, what dosage should I give him? The new word, dosage. Okay, so here we have like a practice for this grammar spot. Can you match the beginnings and endings of sentences? You match beginnings and endings together. I give you 5 minutes for this task. You can take a look at your book, page 23, you have the first task. The first exercise here, you match the beginnings and endings of the sentences. For example, check that you match with D, right? Check that the patient is breathing, right? Check that the patient is still breathing. See, check that the patient is still breathing. It's still alive. Okay, still breathing. And give you 5 minutes, okay? When you're done, you can type your answer in the chat box. I'm waiting. Okay, so we try to finish this task and then we can have a 10-minute break. Okay, so number 2, I'll ask a student, you unmute yourself and you read your answers for number 2 for me. Okay, so number 2, can I invite Hoàng Phúc? Are you there?
I'm here.
Okay, so can you read your answer for number 2 for me? Make sure you
Make sure you stay needle.
Use a sterile needle. Thank you. Okay, make sure you use a sterile, needle, a clean needle. Thank you. Number 3, Huỳnh Thu Hường, are you there? Give me your answer for number 3, please. Okay, Khư Thị Hoài Nhung, are you there?
I'm here.
Okay, your answer for number 3, please.
What do I count up between three?
What do I count up to between breaths? Thank you. Okay, so like, do I need to count up to 5 or 3, right? What do I count up to between breaths? Number 4, so Lê Nguyễn Trà My, number 4, don't let. She's not here today. So number 4, don't let the patient try to stand up, right? Don't let the patient try to stand up. And number 5, we have, should I put the burnt area under running water? Of course not, right? You shouldn't immerse, like the burnt area under water. Number 6, shall I bandage the wound now, right? Shall I bandage the wound now? Number 7, don't tie the bandage too tight, right? Don't tie the bandage too tight. Number 8, what dosage shall I give her? What dosage shall I give her? Number 9, take the patient's pulse again. Take the patient's pulse again. And number 10, where do I have to apply the pads? Where do I have to apply the pads? Check your answers for this practice. Okay, so now let's have a 10-minute break. Okay, have your breakfast. I'll see you after break. Break time. Okay, class, so welcome back. Break time is over. So now we continue. I would like to show you how to apply another exercise. Okay, so in this exercise, can you reorder the words to write sentences in this dialogue for me? So for example, like first one, have hands wash your first well, so you reorder the words to say first, wash your hands well, right? Okay, so I give you 5 more minutes. Can you write out your answers on your paper first? And you type your answer in the chat box, okay? Do I use the large syringe? So A say needle, but yes, don't the touch. So you have to put these words in the right order, okay? Okay, so number 1, who can unmute yourself and read your answer to me? Joe, are you there? Ninh Joe, can you read your answers for number 1? Sorry, not for number 1. The next one here for me. A, needle, but yes, don't the touch.
Là đọc cái câu màu đỏ luôn đó thầy. Yeah. Yes, but don't touch the needle.
Okay. So here we have like, wait. We have like yes, but don't touch the needle, right? Okay. Now, next one, how shall I mix the 2 medicines in the same syringe? No, mix together, they never. So you put the words in the right order for me. Okay, so Lê Yến Phương, are you there? Sentence number 2, next one. So number 2, the right answer is no, never mix them together, right? Never mix medicines together. And next one, make sure the side is clean first. Or first, make sure the side is clean. How do I clean it? So we have rub the sides with an alcohol pad. How do I give the injection? Push the needle into the skin and push the plunger down slowly. Plunger, right? Push the plunger down slowly. Pull it out quickly, don't leave it in. And last one, make sure you throw the needle away into the sharps container. Okay, so now I'm going to ask two students. You read like this conversation for me, A and B. Two students, okay, read the conversation for me. Okay, can I invite Lương Thị Kha, please? Oh, I have like a volunteer here. So, okay, Trân Châu first. Trân Châu, you are A. And Lương Thị Kha, you are B. Lương Thị Kha, are you there?
Yes, it is.
Okay, Trân Châu, are you there?
Dạ có nè thầy.
Okay, Trân Châu A, Thị Kha B. Can you read this dialogue for me? Trân Châu, you start first.
Yeah, first, wash your hands well.
Thị Kha.
Do I use the large syringe?
Yes, but don't touch the needle.
So I mix the two medicine in the same syringe.
Shall I, not shall I. Shall I mix it?
No, never mix them together.
It's the same syringe. Good. Next.
Make sure the side is clean first.
How do I clean it?
Good.
Rub the sides with an alcohol pad.
How do I give the injection?
Injection, good.
Push the needle into the skin. Đọc nguyên 4 câu đó luôn rồi thầy.
Yes.
Yeah. Push the plunger down slowly. Pull it out quickly. Don't leave it in. Make sure you throw the needle away into the sharp container.
Yes, thank you. Okay, so we have exercise number 2. Can you make instructions which tell the public what to do and what not to do if a motorcycle accident victim is lying injured by the side of the road? Join the verbs on the left to the endings on the right, adding don't if necessary. Number 1, remove the victim's helmets, right? So that by stay calm. Stay calm. You match the words together. Stay calm, right? Now I give you 5 more minutes, okay? You match the words on the left to the words on the right, okay? To have right sentences. Okay, so have let's say car number 3 have move. So if you have no line match, now you check. Okay, so next one we have like don't move the victim's hand, right? Next one, warn other road users. Speak to the victim and ask their name. Call for an ambulance as soon as possible. Don't light a cigarette. Check for breathing if the victim is unconscious. Control any bleeding and record the pulse every 5 minutes. Okay, so now I stop this slide and we continue. We stop. Okay, so we continue with this part, please. Okay, so now you're going to think of 3 emergencies a member of the public might have to deal with. For each one, write 3 instructions to help them. Tell your instructions to another pair they must guess. Emergency, okay? So now, for example, a patient is unconscious. So what do you do to help a patient who is unconscious? So you use imperative for me, like don't move the patients, make sure they are still breathing, and keep the person warm until medical help arrives. Okay. So now I give you some situation in the chat box and you use imperative and tell me what to do. Okay. Okay. So first one, someone is okay, so what do you do in this situation if someone is infected with COVID-19? Okay, remember to use imperative for me. Use imperative to give advice and instruction. Okay, start with a verb. Okay, so condition number one, situation number one, someone is infected with COVID-19. You can type your instructions or advice in the chat box, okay? Okay, so Jingzhou said that, okay, well, we need to quarantine the patient, okay? So we use imperative, right? Okay, quarantine, quarantine the patients. What else do we need to do? That's the first step. Okay, so I have a task for you. I have given you like four more like situations, and you have to tell me what you will do in these situations. Okay, use imperative and tell me what to do. Okay. You choose a situation. For example, you choose situation number 2, 3, 4, 5, and use like an imperative, okay, like to give me some advice and instructions on how to deal with those problems. Okay, I'm waiting. I give you 5 minutes, please. If you want to remember this memory spot, okay, like you have to participate and type your answer in the chat box. Okay, that's how you study online. Okay, so thank you, Tim Joe. Seems like you are the only one, okay, to give me the answer, okay? So, situation 2, squeeze the artery if necessary. Keep the patient lying down. Don't move the affected area until the bleeding has stopped flowing. That's right. Thank you. Okay, so let's move on to the reading part. Okay, so we have listening part, but like I'll start with the reading part first. If we have time, we will get back to the listening part later. Okay, so reading parts. Okay, you look at the pictures. What do you think the article is about? Can you guess? Okay, so you discuss these questions with your partner. Have you ever helped with a birth? How was it? Were you born in hospital at home or somewhere else? Have you heard of any births that happens in an unusual place? Okay. Okay, so you can answer these questions for me. I have like 3 speaking questions here. Okay, Võ Công Hiểu, are you still there? If you're still there, please unmute yourself. Don't be shy to talk to me, okay? Nguyễn Thị Thảo Ngọc, are you there?
Yes,
Okay, so first question, have you ever helped with a birth? How was it?
I think I have never.
Oh, you have never helped with a birth, right?
Yeah.
Okay, so move on to question number 2. Were you born in a hospital, at home, or somewhere else?
I was born in hospital.
Hospital. Have you heard of any births that happens in an unusual place? Unusual means strange place. Not in a hospital or at home, but maybe like on an airplane, in a car.
I have heard about a bird on the boat on the river.
On the river, on the boat. Thank you. Okay, someone giving birth. Okay, on a boat. Thank you. So now we read the text and answer the questions. Surprise. Passengers. Okay, so I'm going to give you here. Okay, like about 3 minutes. Can you skim read this text for me? All right. If you have the book, you can open your book to page 25 and you skim read the text here for me in 2 to 3 minutes, okay? Okay, so now I ask the students to read. Okay, like this paragraph for me, this text for me. Okay. Um, Phạm Mai Bích Duyên, are you there?
Yes, I'm here.
Okay, so can you help me read this short text? Let's go. British taxi driver.
British taxi driver. Right,
Lawrence.
Lawrence came a midwife for an hour when a passen- passenger pass, passenger
Passenger.
passenger gave birth to a baby in the back of his taxi.
Mm.
Tiếp luôn thầy.
Okay, next. This one, please. Asha Gemachu's baby.
Asa Gamachu baby was due in a month, but when her contraction started, she called for a taxi to take her to hospital. Mr. Lawrence answered the call.
Answers the call. Next one, the expectant.
The expectant nurse was in the taxi for 10 minutes. When she realized that things were happening too fast, the baby were not going to wait. It appeared, and Mr. Lawrence stopped the taxi to have with the bird. Mr. Lawrence says, I was there when my kids were born, so this was not complete,
Completely new for me.
completely new for me. I spoke to a nurse on the taxi ride too, and she gave me instruction.
She gave me instructions.
She gave me instruction. I only did what she told me. There's nothing special about that. 1 minute and had one passenger. Then I had to, but they're not extra
But there's no extra charge. Charge is like the money. No extra charge.
No extra charge. A midwife at the hospital says giving birth on the way to hospital doesn't happen often. But if you there when it just about the baby hit and
Got it out.
it
Got it out.
got it out. Don't pull dangling the baby nurse and month, but don't cost the
Umbilical cords.
umbilical cord. Just lay the baby on the mother
Chest.
cord, and or dry the baby with a green
Towel.
towel or cloth. Gently proof is back, then cover mom and baby with a bright blank to
Blanket.
keep them
With a try.
blankets
Blanket, yeah.
to keep them both warm and wait for medical help to arrive. Uh, life was wonderful, the mother says later. He did everything right. Asa is naming the baby Mohammed Clive.
Mohammed
Mother
Clyde.
and baby
Mm.
Mother and baby are both doing well.
Thank you so much. Yes, you're done. Okay, so now can you answer these questions for me? Before you answer the questions, we have a new word here. We have umbilical cords. I give you Vietnamese meaning and okay, you can take notes. Umbilical cords. Here we have another word like contractions. When her contraction started. What else? Up here. I said only two new words, I think so. And midwife. Wife is a nurse who helps deliver babies. So the right Vietnamese equivalent is this word, okay? Okay, so after skimming the whole text now, we read the questions and we find the answers. Analyze some keywords in the questions here. Question 1. Was this Clive's first experience of a birth? So we have like Clive's first experience and birth keyword. You read again and you find the answers for me, right? Question number 2. Who gave instructions to Clive? Instructions, keywords. Who is Mohammed Clive? Mohammed Clive. And how is the baby? How baby? Okay, I'll give you 4 more minutes to read again and find the answer for me. Remember to find the evidence in the reading for me. Okay, so for the first question, can I invite Hong Ung? Hong Ung, are you there? Oh, Jing Zhou, you know the answer for number 1, okay? Unmute yourself and give me your answer for number 1.
Dạ anh thầy là câu 1 là no he was not.
Why? Why do you know?
Xong
Is
cái
no,
câu
he
dẫn
wasn't.
chứng là Mr. Lawrence said I was there when my kids were born. So this was not completely new for me.
Excellent. Yes, In the third paragraph, paragraph number 1, 2, 3, fourth paragraph here, Mr. Lawrence said, I was there when my kids were born, so this was not completely new for me. So it wasn't like his first experience of giving birth. So this is the right evidence for number 1. So number 1 is no. You write your short answer. No, it wasn't like Mr. Clive's first experience of a birth. Thank you, Joe. Okay, now number 2. Who gave instructions to Clive, to Mr. Clive? Okay, for number 2 here, can I invite Trần Thanh Hằng, please? Are you there? No. Okay, Trần Ngọc Linh, are you there? Trần Anh Như.
Yes,
You're
I'm here.
silent. Oh, Anh Như is here. Very good. So, question number 2. Who gave instructions to Clive? You just keep reading and you find the answer for me. Who gave instructions to Mr. Clive?
Mr. Lawrence give instruction to Clive.
Okay, so actually here, I spoke to a nurse. See this one? Can you read the sentence for me? I spoke to a nurse.
I spoke to a nurse on the taxi radio and she gave me instruction.
See, right? Okay, so the nurse was the person who gave Mr. Clive instructions. Thank you. So this is the evidence for number 2. Okay, now question number 3. Question number 3. Who is Mohammed Clive? Easy one. So, there's a volunteer. So, can I invite Võ Công Hiệu, please?
Thưa thầy là the baby.
Baby, how do you know? Show me the evidence. Where? Show me the evidence, please. Or can you find the answer in the reading?
Là cái chỗ là Asha naming the baby Mohammed Clive.
The last sentence here, right? Okay, Asha is naming the baby Mohammed Clive. Very good. This is the right evidence for number 3. Thank you, Công Hiệu. Very good. Okay, now number 4. How is the baby now? How is the baby now? Raise your hand, please. Okay, Chu Lan Anh. Very good. How is the baby now?
This in the last paragraph. Mother and baby are both doing well.
Very good. Mother and baby are both doing well. So they are in good health condition. Right, okay. So this is the evidence for number 4. Thank you. You see, like it's not difficult. Okay, so here we have like some more new words that you can learn. Okay, so we move on to here, the next reading. Okay, it's my job. Okay, so worldwide, somebody is killed in a car accident every 30 seconds. So this is the statistics from WHO, World Health Organization. So here is my job. We have another text to read. Read about Chef Oliver and answer the questions. Chef Oliver, here. Okay, you skim read for me. I give you 2 more minutes to skim read and you answer these questions for me. When did Chef decide to become a paramedic? So keyword paramedic, become. Number 2, how long did he train for the job? Train, job, and how long, right? Number 3, what things do you have to be, okay, or what things do you have to be good at, okay, to do chef's job? So here we need like the word to. Can you add to for me, okay? What things do you have to be good at to do chef's job? Things, good, chef's job. Who makes chef's job difficult? Makes job and difficult. Okay, I give you 4 minutes to find the answer. Read and find the answer for me. Skim read first. Always skim read the whole text first to get the general idea, and then you get back to the questions and the right keywords and you scan the answer for me. Okay, the reading techniques are always the same. Skimming before scanning. Okay, 5 minutes. Okay, I'm going to ask the students to read this short text for me. So who volunteers to read? Oh, what Minh Hy, very good. Can you unmute yourself?
Yes.
Okay, so can you help me to read
Can you
this
scroll
text?
down?
Yeah, okay. Chef Oliver, let's go.
I'm Jeff Oliver. I'm 24 years old. I decided to become a paramedic when I saw two of them treating a driver at the scene of an accident when I was a boy. I started as a trainee ambulance technician and trained for 2.5 years to become a qualified paramedic. Now I administer life-saving procedures myself. It's part of my everyday work to defibrillate the heart of a cardiac arrest, to apply splint to limbs and trash wounds, and to set up trips. I have to make quick decisions. It's an important part of giving emergency treatment. So it's communicating clearly and keeping a clear head in some difficult situations. And situations are often very difficult, especially when we have to deal with people under the influence of drugs and alcohol. But paramedics don't think twice. We are always first at the scene when there is a suicide, a road accident, or a fire. When you save a life, it's the best job in the world.
Thank you. Okay, so we have some new words here. First one, we have I started as a trainee ambulance technician, right? Trainee. I now I administer life-saving procedures myself. Okay, as part of my everyday work to defibrillate the heart of cardiac arrests. Defibrillate a heart of a cardiac arrest to apply splints to limbs and dress wounds and to set up drips. So first one, you take notes of this new word, okay? Defibrillate. First one we have defibrillate. Right, follow this new word. To make a heart start beating again. Okay, so this is a verb. Okay, so if you defibrillate, okay, a heart of a patient with a cardiac arrest, you are trying to make that heart beat again, right? Okay, so we have defibrillated. Defibrillated. Okay, defibrillator. So next one we have cardiac arrest. Cardiac arrest. I think you have learned the word splints already, right? Wounds, self trips. So have set up IV trips, for example. Okay. Sub IV drips. So IV stands for intravenous. 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 Okay. Okay, so let's see. Any more new words that you can learn from this text? I have to make quick decisions. It's an important part of giving emergency treatments. Okay, that's it. We have like suicide too. So if someone commits suicide, they try to kill themselves. Okay, suicide. Okay, so now we have 4 questions. The answer here. Question number 1. When did Jeff decide to become a paramedic? Raise your hand, please. Oh, Út Nhi, very good.
Dạ thầy là Jeff decide to become a paramedic when he saw 2 of them treating a right at the scene of an accident when he was a boy.
Very good. Yes. The sentence in the first paragraph is the evidence for question number 1. Okay. He decided to become a paramedic when he saw 2 of them, paramedics treating a driver at the scene of an accident when he was a boy. Thank you. And he was very impressed by the acts, by the professional acts. So when he grew up, okay, he became a paramedic too, right, to help people. So question number 2, how long did he train for the job? How long did he train for the job? Ngọc Linh, Trường Ngọc Linh, very good.
Have a year to become a qualified paramedic.
Okay, very good. So he trained for 2.5 years, right? Okay, to become a qualified paramedic. So this is like the evidence for number 2, 2.5 years. Okay, question number 3. What things do you have to be good at to do Jeff's job? What kind of skills or abilities that you should have to do jobs, to do like Jeff's job well? Okay, Jung Châu, please.
Dạ thưa thầy là I have to make quick decisions.
What else? Just quick decisions. Of course, you have to make quick decisions. What else? You have to communicate clearly, right? And keep a clear head in some difficult situations, right? Okay? And situations are often very difficult, especially when we have to deal with people under the influence of drugs and alcohol. So these are all the things, okay, that a paramedic needs to have, right? All the abilities and skills. First one, so that person needs to know how to make quick decisions, okay, how to communicate clearly, and how to keep his or her head clear in some difficult moments, in some difficult situations. Evidence for number 3 here. Number 4, who makes Jeff's job difficult? A volunteer, please. Who makes Jeff's job difficult? If no one volunteers, let me show you, okay? And situations are often very difficult, especially when we have to deal with people, right, under the influence of drugs and alcohol, right? Okay, so people or patients who are drunk, okay, are very difficult to deal with, right? The evidence for question number 4. Okay, so now let's move on to part 2. Can you join these word combinations used in a text for me? That will help I become a qualified paramedic. Number 2, can you type number 2 for me? Deal with. Type your answer in the chat box, okay? Okay, so type your answer in the chat box for me. Do with. Do with what? Two E. So how about I deal with people, right? Okay. Deal with people. Give. Give what? Thank you, Jinzhou. Give a life? I don't think so. I have like to give treatments, right? To give treatment, not to give a life. And to make decision, right? Save a life and start as a trainee, right? Okay, start as a trainee. So we have for the verb, you have the word like trainee and trainer, right? Trainee like is the person, okay, like who starts doing something new, right? Okay, and trainer is a person who has a lot of experience, okay, to help the trainee. So the trainer trains the trainee, right? Like examiner and examinee, right? Okay. Okay, now question number 3. Would you like to do chef's job? Can you show me your opinions in the chat box, okay? Tell me why or why not. Would you like to do chef's job? Why or why not? Would you like to become a paramedic like chef, like Mr. Chef? Why or why not? Okay, can we continue? So here, we have like one more exercise. Okay, signs and symptoms of shock. Okay, paramedics often have to deal with shock, condition that is often caused by major trauma, such as a traffic accident, right? Shock occurs when the heart is unable to supply enough blood to the organs. This results in a slowing down of the vital functions and can cause death. Shock is difficult to diagnose in its early stages, which makes it hard to treat. Read about the signs and symptoms of shock and complete them with words below. Let me teach you some more new words. First one we have dangerously. You can take notes of this word in the chat box, okay? Dangerously. Okay, next one we have abdominal. Naturally. Abdominal. Next one we have a respiratory. Respiratory. Naturally. Respiratory. Next word we have abnormally. Abnormally. Next one we have gastrointestinal. Adjective. Okay, so you still remember the suffix. I mean like the prefix gas. Gas is related to stomach. Okay. Intestine related to like the bowel. Or the suffix answer, a prefix answer, answer relates to the intestine. You know, enterology, right? Enterology, study of intestine. We have intestine and large intestine. Small intestine. And large intestine. Okay, next word. Blood pressure, easy. Blood pressure. Cardiovascular. Cardiovascular. Root word cardi relates to heart. Cardi, heart. Vas relate to the artery. Artery or blood vessel, right? Next one, helper intestines, already explained. Coma. We have the phrase sing in coma. Sink in coma. And central nervous system. Okay, so now can you read about the signs and symptoms of shock and complete them with words below? Complete sentences with the words I've taught you, okay? 5 minutes for you. Okay, so what's your answer for number 1 and 2? Number 1 first. Can you type number 1 first? The is affected. This can cause changes in personality and restlessness. In advanced stages, confusion, and ultimately, something can result. Number 1 and 2. Okay, so you look at my PowerPoint slides and you can check your answers. The central nervous system is affected. This can cause changes in personality and restlessness. In advanced stages, confusion and ultimately coma can result, right? Next one, the temperature may be abnormally or dangerously low or high, okay? Next one, cardiovascular problems may develop. Patient's heart often beats abnormally fast, but heavy bleeding may cause it to beat slowly, right? And number 5, an abnormal increase in breathing rates can lead to distress or failure. Good. An abnormal increase in breathing rates can lead to respiratory distress or failure. So we have respiratory distress. Another new word for you, respiratory distress or failure. Failure. Respiratory distress, respiratory failure. Number 6, we have blood pressure can be high in the early stages, but then hypotension is common as it falls. Okay, so here we have hypertension. So the prefix hyper relates to something increased or higher than normal. So hypertension is the high blood pressure. Right? And the opposite of hypertension, we have hypotension, right? Hypotension is the low blood pressure. Hypo relates to something decrease or lower than normal, right? Hypertension. Okay, so blood pressure can be high in the early stages, but then hypotension is common as it falls abnormally or dangerously low. Okay, so now we continue with the book. We get back to the listening part because we still have time now, so we get back to the listening part. Oh, and I haven't finished this part, sorry. Next one. Why gastrointestinal problems arise from a lack of blood supply. The intestines can stop working and start to die. This can cause abdominal pain, nausea, vomiting, and diarrhea. Check your answer, please. Let me share the book with you again. And now we get back to the listening parts. Here, listening, part 1. So here, like we have a new word. Oh, I have typed this new word in the chat box for you already. Okay, so let's read through the definition of this new word. Defibrillator is used to make the heart start beating correctly after it has stopped or become irregular. It works by sending an electric shock through paddles or electrodes placed on the patient's chest. New word, okay? Okay, listening instructions. Work with a partner to put these pictures in a logical order. Describe what is happening in each one. So to look at these pictures, I give you like 2 minutes. Can you put like these letters in the right order for me? Which picture do you think should be the first step? And step 2, 3, and 4, okay? So the right order is DBAC, right? DBEAC. DBEAC, okay, is the right order of CPR procedure. Okay, we're going to listen to a student nurse receiving instructions from a paramedic and check your answer, okay? Now we check your order, check your answer.
Listening. Instructions.
Roger, Oscar Lima Charlie, we're with the patient now. Possible cardiac arrest. Stand by. Over. Nurse, check his pulse.
There's no pulse.
Okay.
He's not breathing.
It is a cardiac arrest. Give him CPR. I'll talk you through it, okay?
Okay.
Give him mouth to mouth first. Support his head. That's it. Lift it back. Right. Hold his nose closed, then open his mouth and breathe strongly into it. Give 2 full breaths into his mouth, okay?
Right.
Let his chest fall again. Nothing?
Nothing.
Turn his head. That's right. Put your hand on his chest. Now put your other hand on top of your first hand, okay?
Okay.
Push down a little and release. Do it again. 1, 2, 3, 4.
How many times should I do it?
Repeat the procedure 15 times. Okay, check his pulse again. Anything?
No. Still no pulse.
Okay, don't wait. Use the AED. Set it at a charge of 200.
Right? It's 200.
Apply the pads to his chest.
Where do I put them?
Put one above the heart and one below. Stand clear of his body. Make sure you don't touch him. Call everybody clear, and then press the buttons and hold for 2 seconds, okay?
Okay. Everybody clear!
Check his pulse again.
Nothing.
Are you sure?
Yes. There's no pulse.
Okay, repeat the procedure. Same charge, 200.
Right. Everybody clear? There's a pulse.
Good, well done. Now set up an IV and give him lidocaine.
How much shall I give him?
100 ml over 2 minutes.
Okay, so you know, like you have just like listen to all the steps, okay, like to help a patient with a cardiac arrest, okay, and finally, okay, like the woman, okay, succeeded in like making like the heartbeat of the man, okay, start again, right? Okay. So we move on to this one, okay. We're going to listen again. Now you underline the correct option in italics for me. Example, the patient has had a stroke. No, so you underline a cardiac arrest. Okay, we read through like the 8 questions here, the 8 sentences here, and you underline the right answer for me. Like the nurse gives 2 or 3 breaths into the patient's mouth. So our keywords, breaths, right? Number 2, paramedic counts up to 3 or 4 after each push down on the chest. calves. Right. Number 3, the nurse pushes down on the chest. Pushes down on the chest. How many times? 15 or 16. Okay. Number 4, they set the charge. They set the charge on the defibrillator at 100 or 200. Okay. Number 5, the nurse applies the pads on each side or above and below the heart. Number 6, the patient starts to respond. Patient starts to respond after the first or second charge from defibrillator. The patient is given. So what kind of medicine, what kind of medication is given, right? Lidocaine or atropine. Dosage over 1 minute or over 2 minutes, right? Okay, 200 milliliters, okay, or 100 milliliters over 2 minutes. Listen and circle the right answers for me, okay?
Unit 4. Listening. Instructions.
Roger, Oscar Lima Charlie, we're with the patient now. Possible cardiac arrest. Stand by. Over. Nurse, check his pulse.
There's no pulse.
Okay.
He's not breathing.
It is a cardiac arrest. Give him CPR. I'll talk you through it, okay?
Okay.
Give him mouth to mouth first. Support his head. That's it. Lift it back. Right. Hold his nose closed, then open his mouth and breathe strongly into it. Give 2 full breaths into his mouth, okay?
Right.
Let us...
Okay, so raise your hand for the first one. Very easy. Did you listen? Okay, so I invite Phạm Ngọc Khánh Như. Are you there? Can you give me your answer for number 1? How many breaths did the nurse give the man? Okay, 2 breaths or 3 breaths? No? Can you type your answer, please? Because you are too silent. The nurse gives 2 or 3 breaths into the patient's mouth. 2 or 3. Thank you, Thanh Hà. 2 breaths, right? 2 breaths. Now we continue.
Chest fall again. Nothing?
Nothing.
Turn his head. That's right. Put your hand on his chest. Now put your other hand on top of your first hand, okay?
Okay.
Push down a little and release. Do it again. 1, 2, 3, 4.
Okay, very clear. Number 2, the paramedic counts up to 3 or 4 after each push down on the chest. 4, very good. So here we have I circled 2 breaths, and now 4. You push down 4 times on the chest. Next one.
How many times should I do it?
Repeat the procedure 15 times.
Okay, next one, number 3. The nurse pushes down on the chest how many times? 15 times. Very good. 15 times. Next.
Okay, check his pulse again. Anything?
No, still no pulse.
Okay, don't wait. Use the AED. Set it at a charge of 200.
Okay, number 4. They set the charge on the defibrillator at 200. Yes.
Right? It's 200.
Apply the pads to his chest.
Where do I put them?
Put one above the heart and one below. Stand clear of his body. Make sure...
Okay, the nurse applies the pads on each side of the heart, or one above and one below the heart. Which one? Yes, one above and one below the heart. Here. One above and one below the heart. Number 6.
you don't touch him. Call everybody clear, and then press the buttons and hold for 2 seconds, okay?
Okay. Everybody clear.
Check his pulse again.
Nothing.
Are you sure?
Yes, there's no pulse.
Okay, repeat the procedure. Same charge, 200.
Right. Everybody clear? Ah, there's a pulse.
Good.
Okay, so the patient starts to respond after the first or the second charge from the defibrillator. First try or second try? Second try. Very good. So circle second try was successful. Next one.
Good. Well done. Now set up an IV and give him lidocaine.
Set an IV and give him. The patient is given lidocaine. Very good. Lidocaine.
How much shall I give him?
100 ml over 2 minutes.
The dosage is 200 ml over 1 minute or 100 ml over 2 minutes. Which one? 100 ml over 2 minutes. Good. 100. Okay, a milliliter, right? Over 2 minutes. 100 ml. Milliliter. Okay, number 4. We complete each sentence with a verb from the list. Then listen again to check. I'll give you 2 minutes first. Let's learn some more new work with the verbs. You have a guess first, and then I'll let you listen and check your answer later, okay? Okay, so now you listen and you check your answer, okay? Track number 11.
Unit 5. Listening 1.
Oh,
A pain chart.
now, not this one, sorry.
Unit 4.
Okay.
Listening. Instructions.
Roger, Oscar Lima Charlie, we're with the patient now. Possible cardiac arrest. Stand by. Over. Nurse, check his pulse.
There's no pulse.
Okay.
He's not breathing.
It is a cardiac arrest. Give him CPR.
Okay, first phrase. Can you type your answer in the chat box for the first phrase? CPR. Give him CPR. Good.
Talk you through it, okay?
Okay.
Give him mouth to mouth first. Support his head.
Okay, so next we have like number 2. Give him a mouth to mouth first and support his hand, right? Okay. Here's number 1. Number 2 is give. Number 3 is support. Support his hand.
That's it. Lift it back. Right. Hold his nose closed.
Next one we have like hold his nose closed, right? Hold number 4. Hold his nose closed. Then your hand on his chest.
And open his mouth and breathe strongly into it. Give 2 full breaths into his mouth, okay?
Right.
2 full breaths.
Let his chest fall again. Nothing?
Nothing.
Turn his head. That's right. Put your hand on his chest.
Put your hands on his chest, right? Next word, number 5, we have put your hands on his chest.
Now, put your other hand on top of your first hand, okay?
Okay.
Push down a little and release. Do it again. 1, 2, 3, 4.
How many times should I do it?
Repeat the procedure 15 times. Okay, check his pulse again. Anything?
No. Still no pulse.
Okay, don't wait. Use the AED. Set it at a charge of 200.
Right. It's 200.
Apply the pads to his chest.
Where do I put them?
Put one above the heart and one below. Stand clear of his body.
Oh, we have like stand clear of his body, right? Stand clear. Number 6, stand clear of his body.
Make sure you don't touch him.
Make sure you don't touch him, right? Then the buttons and hold for 2 minutes. Sorry, for 2 seconds.
Everybody clear, and then press the buttons and hold for 2 seconds.
Press the buttons. Press the button. Number 7, press the button and hold for 2 seconds.
Okay?
Okay. Everybody clear.
Check his pulse again.
Next one, we'll have to check his pulse again, right? Number 8, we'll have to check his pulse again.
Nothing.
Are you sure?
Yes, there's no pulse.
Okay, repeat the procedure.
Repeat the procedure. You start again, okay? Repeat the procedure, number 9. And the last one is number 10, right? Repeat the procedure. And you listen.
Same charge, 200.
Right. Everybody clear? There's a pulse.
Good, well done. Now set up an IV and give him lidocaine.
How much shall I give him?
100 ml over 2 minutes.
So last one is set up an IV and give him lidocaine, right? 100 ml over 2 minutes. That's it. Okay, so we have just finished with the listening part. Okay, so now let me find a game for you. Okay, you can start this grammar game. So please wait for me to help you review how to use past simple and past continuous. Okay, I choose this game for you.